Okay, welcome everyone. Thank you so much for joining us today. We are presenting today. Oh, there you go. Approve. All right, today we are having a webinar titled Accessing Community-Based Services Through 1915I. I am so excited to have Ginger Yarbrough here with us today. She is the Chief Clinical Officer for IDD, TBI, and Olmstead with the Division of Mental Health, Developmental Disabilities, and Substance Use Services. My name is Christy Moore, and I'm the Family to Family Health Information Center Program Lead with the Exceptional Children's Assistance Center. And I have shared my email address there, and I will share it again during the presentation and at the end in case anybody has any questions or would like to reach out for some assistance. And that is a picture of my 14-year-old daughter, and she is the reason why I do this work. Okay, I'd like to just go through a little bit of housekeeping before we get started. This webinar is being recorded, and a link to the recording, along with the slides and additional information on 1915I services, will be included in the follow-up email that will be sent out to everybody who registered. My goal is to try to do that by the end of this afternoon. If not, it will be definitely by Monday. Please put all of your questions in the Q&A section that's located at the bottom of your screen, and we're going to answer those at the end. We have plenty of time set aside for Q&A, and this is to give Ginger time to get through all of the material, and maybe your questions will be answered along the way. Also, I do want to mention that we are happy to answer general questions about 1915I and how to access these services and what they are. But if you have a question that is very specific to your personal situation, we're not going to discuss like personal situations on a public forum like this. So feel free to email me your questions or your concern, and I will work with you to get you the assistance and the answers that you need. Due to the large number of attendees today, we're not going to be able to unmute participants to allow them to talk, but if you have additional questions or, again, very specific questions that pertain to your personal situation, please email them to me. And I will share my email address periodically and then again at the end as well. Also want to mention that I'm going to launch an evaluation poll after Ginger gets through presenting, probably before the Q&A. ECAC is largely funded by grants, and we collect data on our activities for grant reporting purposes and to make improvements and to create content that meets the needs of families and professionals across the state of North Carolina. And now more than ever, your feedback is very important because we would like to be able to show that what we do is helpful to our audiences. And we really, really appreciate your feedback. Okay, with that, I am going to stop sharing my screen and I am going to turn it over to our presenter, Ginger.
Sorry, whenever I start sharing my screen, the mute button disappears, and so I have to go and find it. So I hope everybody can hear me. Thank you so much, Christy, for inviting me and ECAC for having me. I'm really excited to be here and share with you guys about 1959 services. As Christy said, my name is Ginger Yarbrough. I am the Chief Clinical Officer for IDD, TBI, and Olmstead. Sorry, I have not updated my title on this slide, but I have 25 years experience in the field. I actually started as a direct support professional, working with a young boy with autism and just fell in love and have stayed in the field ever since. I've worked as a provider, a care manager, and my recent position before coming to the state was in quality management at one of our tailored plans. I've been with the state for about 2 years now. And yeah, that's a little bit about my background and experience. So again, I'm really excited to talk through what the heck 1959 services are and how to access those services. So starting out, 1915I is really just a fancy term for the Avenue to Home and Community-Based Services. These are free services and are designed to help people, including members and caregivers, get the supports that they need to live where they want to live. When we talk about members in this presentation, we are talking about people with a disability who have Medicaid. When we talk about caregivers, we mean those people in the person's life who are not paid supports. So family members, neighbors, grandparents, parents, all of those unpaid supports. But those are the people that are providing care and support for the member and to the member. Um, to be eligible for these services, you must have a 1915I assessment. We're going to go over how to do that in just a few minutes, and be diagnosed with a serious mental illness, a severe substance use disorder, a traumatic brain injury, or an intellectual or developmental disability. And many of people that are receiving these services have co-occurring diagnoses in these categories. You also must have Medicaid to receive these services. So, what services are available? The services that are available include community living and supports, supported employment, individual placement and support services, respite care, individual and transitional support, and community transition. For those of you who have family members or loved ones that are on the Innovations wait list, or it used to be called the Registry of Unmet Needs, receiving 1915I services will not impact your waitlist position at all. So if you're on the wait list and have Medicaid and choose to receive 1915I services, you will maintain that same placement on the wait list. And you will keep your spot. You're not going to be taken off. There's nothing punitive about it. So you can get these services and stay on it. To find out which of these services you might be eligible for, please contact your tailored care manager, or you can call your managed care organization. And you'll see here at the bottom of the slide, we've got all 4 managed care organizations listed. You'll hear me use the word managed care organization or tailored plan. Those are the same entities. So Alliance Health, Partners Health, Trillium Health, and Via Total Care are those 4 tailored plan entities. If you have Medicaid through a standard plan and need these services, you would need to transition to a tailored plan to access these services. And you can do that by initiating it with your standard plan provider. I want to point out that not all of these services are available to everyone with Medicaid. Each service has very specific diagnoses and ages that determine the eligibility. So we created this handy dandy chart, but we're going to cover each of these services as we go through the presentation. I find this as someone in the field to be super helpful, as a quick glance to say, all right, does this person have IDD? Yes. What is their age? And then you can see what services are available for them. Another thing to mention, there are some specific limitations for each of the services. So, for example, supported employment and community living and supports, you can get both of those services. However, the total number of hours for an adult is 40 hours a week. So, let's say you get 25 hours of community living and support, but you also need supported employment. That supported employment would be limited to 15 hours a week. And that's just an example. This looks different for everybody, really depending on what your needs are. If you're still in school or under 22 years old, there are other specific limitations, which I have down here at the bottom as well. Your care manager can really support you in determining the limitations and the best combination of those hours to make sure that your needs are met. For individual placement and support, or IPS, you can only have one provider at a time during an authorization period. Again, this is where the care manager is really crucial to make sure that you're following all of these limitations and understand how these services work together. And this one is really more for the providers, and that's because the service is only billable for one direct employment service and support. I'm including this slide. It's very well past the deadline for all of this to happen, but we used to have a set of services called B3 services, and everyone who was receiving 1915I B3 services that were eligible for 1915I should have already made that transition. To my knowledge, they all have, and there should not have been a lapse in service as they were transitioning. So if you start hearing those terms, it's just that is an old term, 1915 IB3. All right. So now I'm going to go through some of those specific services that I alluded to earlier. So, community living and support. This is a service that is designed for teaching and promoting independence for people with IDD or traumatic brain injury. Um, there are some elements of personal care, and this is probably one of the most requested services. It's really a person is working one-on-one with your loved one to go to teach different activities of daily living. So they may help someone through their meal planning process. So providing prompts or support through choosing the meal they want to prepare, going through their groceries to make sure they have everything they need, and then even includes potentially taking them grocery shopping for the things that they may need. Another example could be supporting that person through their bathing and dressing routine for the day. So either doing maybe some hand over hand with bathing or some modeling or prompting through getting dressed for the day and choosing the appropriate clothing and for the weather. Um, all of this habilitation and teaching is really geared towards learning those skills over time and to promote independence. So, who is eligible for this? You must have a functional deficit, so you must be able to show that there is a need and can benefit from skill acquisition. So, you can benefit from these teaching services and can benefit from assistance in monitoring a health condition or living skills. Um, Also, these are available for individuals with intellectual and developmental disabilities or a traumatic brain injury. Supported employment is another service that is highly used, and this one's probably one of my favorite to talk about. Supported employments are for people with intellectual and developmental disabilities or traumatic brain injury and to go through the employment process. So, helping somebody determine what kind of job the person wants, building the skills and resume to actually acquire that job. They can go with the person to their job and provide one-on-one job training and support navigating the work environment. I don't know if you remember starting to work. It can be really scary and really overwhelming. And so having someone there helping to navigate those, maybe something that's not as black and white as something in an HR rule book, but how to navigate those relationships. They can also help support the person planning how they're going to get to and from work if they do drive. Something I want to emphasize here is you don't have to already have a job or even know what kind of job you want in order to use supported employment. You merely just have to want a job. One criteria is you would have to go through vocational rehabilitation, which is now known as the Division for Employment and Independence for People with Disabilities, EIPD, just another acronym to throw out there. But most people go through that through their school system or can get a referral fairly easy. The Taylor Care Manager can help get a referral to EIPD as well. So again, it's needs-based criteria. You have to want to work, have a pattern of underemployment or unemployment, or have educational goals that relate to employment goals. This is available for people that are 16 and up with intellectual and developmental disabilities or a traumatic brain injury. Um, Individual placement and support. So this is similar to supported employment, but is geared towards individuals with severe and persistent mental illness, serious mental illness, serious emotional disturbance, or substance use disorders. Again, this service helps determine what kind of job you want, build those skills and resume to get the job. It can also include on-the-job training and support navigating that work environment again. And again, you don't already have to have a job or know what kind of job you want. You just have to want a job and have gone through that EIPD process. Needs-based criteria is pretty much the same as supported employment. Express the desire to work, have a pattern of underemployment or unemployment, and have educational goals that relate to employment goals. And again, this is for individuals who are 16 and up that have severe persistent mental illness, SPMI, serious mental illness, or SMI, serious emotional disturbance, SED, or substance use disorder, SUD. And Christy, I will also forward you our acronyms list from DMH. I just realized we have a lot of acronyms within this presentation that might be helpful for folks.
Okay, great. Thank you.
Mhm. Okay. Respite care. Respite is a little bit different of a service. The previous services, we talked about teaching, learning, and creating more independence at home, at work, and anywhere else in the community. Respite is geared towards caregivers often. And again, caregivers means those people in your life that support you and are not paid to do so. Often it's parents, grandparents, friends, neighbors, relatives who you live with. Respite care services provide services and support so that people can take a break and know that your needs are being taken care of. It can be overnight, it could be weekends, weekdays, or it could be an emergency respite situation. And it can be at your house or it can be somewhere else. It doesn't have to be in a specific location. Respite is available for children 3 years old to 20 years old with a serious emotional disturbance or a substance use disorder. It's also for individuals 3 and up, so 3 through the lifespan with IDD or TBI. And really, the only needs-based criteria here is if a person is unable to care for themselves in the absence of their primary caregiver. And respite care, while it seems like a simple service, it's providing that break often gives families and parents and grandparents the time to kind of regather themselves, get a little bit of rest, and continue providing those supports.
Hey, Ginger.
Yes,
I
ma'am.
just a request if you could just slow down just a hair.
Thank you.
Uh-huh.
I'm trying really hard. So thank you for the reminder.
Yeah.
Um, okay. Individual and transitional support. This support is for people with substance use disorder over the age of 16, um, for individuals with serious mental illness or serious and persistent mental illness over the age of 18, and those with serious emotional disturbance ages 16 to 21. So this service can help support recovery from mental health issues or substance use. The service can help you throughout the recovery process, help with accessing transportation, finding a place to live, managing your money, and finding education if that's the route that you're choosing to go to. To access this service, it's really just one deficit in an instrumental activity of daily living. So an example of this could be meal preparation. And finally, we've come to community transition. Community transition is unique in that it provides up to $5,000 to help people move out of a quote approved setting. So, an approved setting is like a psychiatric residential treatment facility, a foster home, a community intermediate care facility, or an ICF, and into a home of their own. So, if somebody wants to live on their own instead of one of these institutional levels of care. Um, people with intellectual and developmental disabilities, traumatic brain injury, substance use disorder, serious mental illness, and severe and persistent mental illness of all ages are eligible for community transition funds. These funds can be used to purchase furnishings, so a bed or a couch. They can pay for setting up power or phone services. They could help purchase bedding and linens. A kitchen is really expensive to set up, so it can help support kitchen setup or a number of other things you need when you're moving into your first place. And again, needs-based criteria for this service is moving to your own community living arrangement, and you just need initial setup expenses or items. Okay, so we talked about the services, but how do you actually access those services? I'm going to walk you through the process here, and we are walking through this process from the member's point of view, so the individual with a disability. So the first step is going to be call your care manager. If you don't know who your care manager is, you can call your tailored plan and they can help connect you. And again, those tailored plans are dependent on the county in which you live. The tailored plans are Alliance Health, Trillium, Partners, and VIA. Your care manager will then complete a 1915I assessment. It is not a long or hard process. It is a very short assessment, but the assessment helps to understand what services might be right for you. And it helps the care manager and the team to develop or update the care plan. You may hear care plan called a person-centered plan, individual support plan, or an ISP, or it just may be called a care plan. A care plan and an ISP, or individual support plan, both incorporate the results of the comprehensive assessment and identify your desired outcomes and what is needed to get to those outcomes. So, what are your goals? And what are those barriers or what's preventing you from achieving those goals? So the assessment is completed. Then you must go through an eligibility determination. The care manager will submit that assessment to the state of North Carolina's vendor. That vendor is called Carillon. Some people hear that thrown around, so they're just the vendor who supports our eligibility determination process. Then, once eligibility is determined, a care plan will be developed. And this happens with an identified provider of service. So you're going to have a tailored care manager or a care manager or a care coordinator helping you go through this assessment process and updating your plan. But you also have a service provider who finds the staff that does the 1915I services in your home and community. Both of those individuals and the natural supports, the family members, the guardians, and the individual receiving the services are all part of the plan development process. If you already have a plan, then it's just an update to that plan. So if you don't have a provider agency while the plan is being developed, that's okay too. This is the time where you'll start looking for a provider agency to provide the services, and the care manager can support finding a provider agency. If you already have one, you can choose to keep the provider or you can change. You are not locked in. So once the plan is written, that care plan is then submitted with a request through what is called the utilization management process. So the care manager will submit this plan requesting that the services be provided through that provider agency. Um, and then once those are reviewed, a decision will be rendered, and if approved, your provider can start services. Your care manager will stay involved. The care manager is there to help make sure that those services are being provided as the plan describes and coordinate your ongoing care. So if things change, and let's say you don't need as many hours or you want different services, you can always call that care manager and let them know, and they can help you update that plan and help you update the services. They can also help if there is let's say the provider agency can't find staff or the provider agency isn't quite meshing with your family for some reason. They can help you change provider agencies if you so choose. And they can help you navigate some of those challenging conversations with the providers as they come up. So I wanted to go through and give a couple of examples of how this might look in somebody's life. So, scenario one, we called it leaving the nest. You'll see that this person, Paula, lives at home with her mom, Jackie. She has a traumatic brain injury. And while she can do a lot of things on her own, Jackie still does all of the meal prep, all of the cleanup after that, and make sure that all the bills are paid. But Paula really wants to live on her own after she graduates from high school. Paula is already connected with a care manager, but she doesn't have any services in the home and community at this time. So Paula or her mom will reach out to the tailored care manager. The tailored care manager then does that 1959 assessment to determine eligibility. The care manager also helps develop an ISP or an individual support plan with Paula and Jackie to identify what those goals are. And in this case, the goals are learning how to cook, learning how to clean up after herself, and learning how to manage her own finances. So this plan then gets submitted and is approved. At that point, Paula starts receiving services. So she has a staff person who comes to her home 3 days a week to help her learn how to organize herself, organize her space. She becomes more independent in the cooking, cleaning, laundry, all of the big things that you need to learn to support yourself in your own home, and even starts managing some of her own expenses. This is a big step towards living on your own. By the time Paula graduates, she is staying overnight by herself and is ready to start looking for an apartment using those 1959 services to continue to support in her own place. The CLS services support you to live independently at home and participate in the community. So a couple of examples again, those services can help with eating, bathing, dressing, personal care, hygiene, and other activities. They can support learning some life skills such as shopping and banking. And then extra support for health and safety. So, managing medications, ensuring that your house is safe, that there's not like tripping hazards or, I'm a homeowner, and sometimes things happen and you have to get things fixed. So, a CLS provider can help navigate those. They can also help provide some health related education and resources as well. Right. In this next example, we meet Alexia. She has schizoaffective disorder, but she's already receiving some 1915 I services. Alexia wants to find a job so that she has money to go out with her friends more often. She has already gone through the Division of Employment and Independence for People with Disabilities, or EIPD. So Alexia tells her care manager she wants a job. At that point, her care manager helps find an individual placement and supported employment provider, so an IPS provider, and updates her plan with her to include those employment goals. Again, Alexia will have to sign off on all of this as her own guardian. And once she receives those IPS services, receives the approval for them, um, she starts to explore jobs. She can update her resume. And in this example, she lands a job as a runner at her local television station. Um, the employment specialist continues with Alexia through the entire hiring process and the training process, and will continue to support Alexia for as long as Alexia would like and needs. So they can be as involved or they can start to back out over time as she becomes more confident in her services or in her job. The other piece of this, if Alexia's situation changes, so if she wants to change jobs, she can always engage more frequently with that provider as well. Um, Also wanted to include some contact and ways to stay in touch and get more information about different services and supports and activities that are going on at the division level. We have monthly side-by-sides. These side-by-sides are hosted by our Division of Mental Health, Developmental Disabilities, and Substance Use Services Director, Director Kelly Crosby. And it's really a great place to come and get the most up-to-date news about what's going on. They do a fantastic job of giving some regular updates and then having some other more in-depth conversations around the different services and supports. And if you want to register, you can use this top QR code. The second QR code, we have a number of advisory committees. We really take to heart that we want the community involvement in all of our decision making and program and policy making. So we have these advisory committees. On those committees, there are people from people with lived experience, there are family members, advocacy groups, tailored plan contacts are on there. We have providers that participate. So anyone that is involved with this community can come and participate in these advisory committees. We really, really believe that we need all the voices at the table. So please join us. And then finally, this third QR code is to join the Division of Mental Health, Developmental Disabilities, and Substance Use Services mailing list. We have a ton of exciting information that comes out through that mailing list, and I encourage everyone to sign up. There is a regular email that comes out every Tuesday called Hot Topics. But we also have special hot topics that come in. So if there's a webinar that's happening, if there are advocacy events, all of those or new resources coming on board, those come out through that hot topics mailing. So please, please, please join so we can stay in touch. And I think now we are at the Q&A session. So I am going to
Perfect.
stop sharing.
Okay,
Uh-oh.
thank you so much. So we have a ton of questions, and I love that. I do want to make sure that if you put a question in the chat and did not put it in the Q&A, if you would please go ahead and put it in the Q&A because that's what we're going to use to answer. Stuff can get lost in the chat pretty easily. So if you would put it over in the Q&A, we will do that. We also want to recognize that we probably will not be able to answer all of the questions, but Ginger has very graciously agreed to, I'm going to send her the Q&A, and she and her team are kind of go through them and are going to do a FAQ or Q&A document that will answer the questions that we did not get a chance to answer live. So we really appreciate that effort. Okay, let's hop on over to the Q&A and get started. Any questions about, will I get the slides? Will I get the recording? The answer is yes. I'm going to email out the recording. I'm going to email out the slides and then any additional information Ginger would like to share on 1915 iServices. I'm going to try to get that out this afternoon, but there's a lot of moving parts when it comes to getting things together in a follow-up email. So if I can't do it by the end of the day today, you will have that by the end of the day on Monday. So let's see. Let's get rid of those. All right, first question. Can someone receive 1915I and CAP-C services at the same time?
I will double check on this answer, but my understanding is no. Because Cap C, your Medicaid is managed under a different resource. And 1959, you have to be on the tailored plan for Medicaid services.
And again, we will include that question on the Q&A doc as well.
Yep.
Okay. Next question. Can someone receive, oh, that's the same thing. So we currently have to have Medicaid to be eligible for 1915I.
You do. You do. However, I do want to remind folks, Medicaid expansion did happen. So there are people that were previously not eligible for Medicaid that are now eligible for Medicaid. Also, as your loved one ages, so when they become 18, we encourage you to reassess Medicaid eligibility.
Okay, next question. If you are under age 22 or 21 and not in school, are you limited to 15 hours of community living and support?
I do not believe so, but we'll include that on the FAQ. Let me double check with my Medicaid partners.
It's an email question. What does community living and support look like for a teenager? I had a parent who stated that she needed the support for her 13-year-old, and the provider I connected her to was confused about why a 13-year-old would need this service.
Oh, that's interesting. So like I said, I was a direct support professional and I actually started working with someone who was like not even 5. So these services for a teenager, I'm trying to think back to when he was 12, 13. We worked a lot on social interactions. We worked a lot on navigating those really challenging social interactions. Um, I think this is for all teenagers. Hygiene. We worked a lot on what does hygiene look like? How do you shave? Um, dressing appropriately for the weather. Those were the things that we worked on. So, 13-year-olds is really dependent on the individual, but there are a number of things you could be working on.
Yeah, hygiene's a good point. I have a 14-year-old.
Mine are 13 and 16.
Yeah. So, okay. What if your child doesn't already have Medicaid? My son and his friends range in age from 16 to 18.
Again, going through that disability determination and Medicaid process is key. And again, at 18, going through it again to make sure. If you are still ineligible for Medicaid, there are some limited state-funded services available through those managed care organizations or tailored plans. And so calling the tailored plan and asking specifically about what services and supports may be available. We are really working hard so that those who are on the state-funded services and have Medicaid, getting them transitioned to the Medicaid-based service to free up some more of those state funds for those who aren't eligible for
That's
Medicaid.
that's great, and I am happy to share some in the follow-up email links to each MCO and information about state-funded services.
Mhm.
Okay, next question. If homeschooled over 18 and a single parent works and is only providing supervision during daytime hours and instruction during off hours, does the hour limit for community living and supports still apply? I'm guessing this may need to be an email question. Maybe.
Yeah,
Withdrawing from homeschool will probably be necessary. So homeschooled over
that's
18, single parent.
that would definitely be a tailored care management conversation to talk with your care manager about that. They can help you navigate because those are very specific situations.
Mm-hmm. Okay, next question. Slides, yep. Um, Many times the family doesn't know who their care manager is. How do they find out if they want to move from standard Medicaid to the tailored plan?
If you have standard Medicaid and qualify for a tailored plan, you would call your standard plan and request the transition, and they should be able to help navigate that. If you are already on the tailored plan and have an assigned tailored care manager, then but you don't know who they are, you can call your tailored plan and just ask. Um, Often what we're hearing is tailored care managers are calling the families that they're working with. And I don't know about y'all, but I don't answer phone numbers that I don't know. And so they may have called and you may have thought it was a scam, or if you're like me, declined the call and just assumed it was a scam. So just call your tailored plan and they can tell you.
Yeah, and I've seen the same thing with folks. If the number shows up as, blocked, or, there's no name or agency or entity that pops up, people are not inclined to answer those. And also, if your voicemail box is full, they can't leave a message to tell you who they were. So, yeah, you just call.
Well, and there are also very specific rules about what information they can leave on the voicemail. So sometimes it comes across as a little sketchy when it's really not a sketchy call. So it's hard. It's very
Right.
challenging.
Yeah. Hoping to have a better understanding of how to guide parents to connect children aging out of early intervention at age 3 to these supports, specifically children with an autism diagnosis or developmental delay.
That is actually something that my team is interested in helping with as well. So my team leads Inclusion Connects, which is the state's cross-divisional IDD service system. So that includes Medicaid, it includes state-funded folks, the EIPD services that come out. And we want it to be kind of that birth throughout your life resource where you can go and find out more information. That is on our work plan to start working with those other agencies. So early intervention is key. Also, division of aging is going to be key in the future for us.
Okay, next question. I'm going to try to do this justice, and if I don't, feel free to reword it. Um, is it okay if the community living and supports worker takes the person with TBI or IDD to make their own stuff, or make them wash the car, or take their own home?
I think I know what this question is.
Okay.
Can the staff person ask the individual with TBI or IDD to wash the staff person's car or take them to the staff person's home?
Okay.
Um, no, the staff person should not be asking the individuals receiving services to do their chores. That should not be happening. For taking them to their own home, there are situations where that does occur, but it is only in very specific situations with the right safeguards in place. So it would not just be on a whim, that's for sure.
Okay. Do services for supported employment only support on-the-job training for 90 days, just like EIPD services? Or if they are receiving 1959, can this continue on longer?
It can definitely continue on longer than 90 days. It is as long as the need is expressed in that plan.
Okay. I figured this one would come up. Please address how a parent or caregiver can be paid as a community living and supports person. In an ideal world, there would be plenty of workers who could do this, but that's not the case. Parents are already doing what is needed for them. And if the caseworker doesn't know that a parent can do this, what can we do? How do we get it going?
So I'm going to need to take this one back and put it on the FAQ. I've gotten a couple of mixed responses, and I want to make sure that we're giving the right information. So my understanding is, as of now, that it is not possible to get 1915I and have relative as provider. But I want to make sure that that's very clear before you take that as gospel.
Yeah. Okay. And that's a popular one. We did anticipate that
Mhm.
one coming.
Yeah.
Can we select or provide our own respite care providers?
If you know somebody that wants to provide the respite services, and they meet the minimum qualifications, then absolutely. And the provider agencies have their own requirements as well, but there are specific requirements. I believe they have to go through very specific training, but if they can do that, then sure. And they have to pass a background check, those types of things. And I'll tell you, providers actually love it when you bring them staff to do those services.
I'm sure. Um, in the work help, okay, hang on. In the work help, the person to know how much hours can work so don't lose benefits. Okay.
Yes, so this comes up a lot. When someone gets a job, they're worried about if they work too many hours, then they will disqualify themselves for Medicaid and then lose all of their services. Um, there are benefits providers through EIPD. They are also getting ready to launch what is called, let's see, DB 101, which is a benefits, it's a support online to help you understand your benefits and how working can impact that. But yes, supported employment should be able to also help navigate that. There's a lot of mythology about how many hours you can work, and we're working really hard to dispel that.
What means overnight care in respite? So I guess maybe what qualifies as overnight care?
I mean, if you're there while the individual, I mean, it's overnight. So if they need support for, let's say, 8 p.m. to 8 a.m., then that would be overnight respite.
Okay. If I read it correctly, it looks like employment assistance may not be available to the developmental disability, but it is available for substance abuse.
So there's two different employment services. For someone with a developmental disability, it is called supported employment. For someone with substance use disorder or severe persistent mental illness or serious mental illness, that's going to be covered under IPS or individual placement and supports.
uh, can the community living and supports and respite person change diapers if the child or adults use diapers?
Yes, yes, they can provide personal care.
Let's see. I'm a single foster mom to three siblings with intellectual disabilities. How or who do I contact for this service?
Um, that would be the tailored care manager assigned to the children. So, and if you don't know who that is, then contact the tailored plan to find out who your tailored care manager is. Hopefully, they all three have the same tailored care manager.
Yes. Oh, that would
That
be,
doesn't always happen.
oh no. Uh,
Yeah.
um, did you say respite service doesn't have to be in the home overnight as well?
Um, so respite does not have to be in the person's home. I need to double check on the overnight piece, but I believe it can be provided outside of the family home.
Let's see. If you initially turn down a service, say respite care, is that something you can later on ask to get? My concern is that there's no one in my area that could care for my child.
Absolutely. So your needs are going to change throughout your life, just like the amount of support anybody's needs change throughout their life. Um, And as your needs change, you can always go back and ask, either for more or less services.
Are there age limits for respite care?
There are age limits for respite care, and it depends on your diagnosis and your age. So, for somebody with intellectual developmental disabilities or traumatic brain injury, it's 3 and up. For mental health diagnoses, it's different, but that will be on the slide, on one of the slides in the presentation. I just don't know those off the top of my head as well.
Okay. And we are going to continue answering questions for sure, but I do just want to launch a quick evaluation poll. We really appreciate your feedback now more than ever. ECAC is grant funded and we use this, it's anonymous, but we use this reporting for our grants to show that the information that we share or work on or create is helpful and useful to those we share it with. Okay, thank you so much. It's real short. For community transition services, if an individual is a student in an inclusive post-secondary education program living on a college campus, could that qualify them to receive this service to transition to an independent housing setup upon graduation?
I am going to encourage you to talk to your care manager in this situation.
That's a good question.
Yeah, it is a great question, though.
I'm going to follow that one as well. Okay. When a person contacts the LME local management entity, managed care organization, so that would be via Alliance Partners or Trillium, to ask for a 1915I assessment, can they apply for the innovations waiver at the same time?
Um, so yes, if you're calling about 1915I, you can get added to the innovations waiver, or you can go through the process to get added to the waiver wait list at the same time. In fact, that's I would expect that to happen,
Mm-hmm. And I have,
but definitely ask.
yes, for sure. And I've done that, with families, and some of the MCOs initiate that process with a phone call, and others initiate that process with you submitting an online form, which is Trillium. And again, I'm going to put my email address in the chat, and if you guys have any questions or need some assistance with applying for the innovations waiver or around CAPC or 1959, feel free to shoot me an email. And if I don't know, I will find out. Or I will bug Ginger. Okay. When a person contacts, oh, we just did that. Does the 1959 assessment have to be given in person? That's a good question.
Question. I don't know the exact answer. I don't think so, but we can include that in the FAQs if you want to get to the questions.
Yep. Good question. And there
I
may
have
be
not
some
been asked that
circumstances.
question before.
Yeah. What happens if we have a plan in place but move to another county with a different tailored plan?
Your tailored care manager will support that transition to make sure that everything gets moved over without a gap in services. Some of it is dependent on if your provider um, is contracted with both tailored plans. You might be able to keep your provider. It could be that if they're not, then you may have to find a new provider, but your care manager is there for that support and coordination.
We have been unable to access respite care through CAP because we were told there's a shortage of per diem respite workers. Is the situation any better through 1915I?
I wish I could tell you yes. Unfortunately, there is a severe workforce shortage nationally. And so we are working really hard to address that workforce shortage. If you're not familiar, we actually have a direct support professional workforce work plan through my section right now, addressing wage issues, addressing career pipelines. And, I think some of it is people don't realize that this is a career choice and making sure people know that it exists. I'm one of those people that kind of fell into being a direct support professional. And I think that happens often.
Next question is, how do you find respite care providers?
A lot of it is word of mouth as a family member. The provider agencies themselves, every every tailored plan has a provider network, and that provider network, when I talk about service providers, those are the organizations that find the individual direct support provider to come to the home. Um, and so your care manager can help you find that provider directory. If you're talking about the individual person, a lot of times it is word of mouth. So,
As was mine.
mhm.
How long is the wait list for these community living and supports?
So there is not a wait list for 1915I community living and supports. Where you may find a wait list, separate providers may have a wait list for services, but the general service doesn't have the wait list. Providers may have their own wait list because of access to those direct support professionals.
Do they continue community living and support services once the individual moves into their own place?
They absolutely can. And let's say the person's living at home, and at home they only needed 18 hours a week of services. When they move into their own place, you may reassess and find that they need additional hours, and you can update the plan at that time.
So this next question screams, I'm a tailored care manager, and I love it, even though it's anonymous, but you're using acronyms that I don't know. Maybe Ginger knows them.
Yes,
Is there any RASDE type service? What does that stand for?
it's, I don't know I hear RADSI said all the time. I
Okay.
don't know exactly what it stands for, but it's really relative as provider. So,
Ooh,
yeah,
okay.
so a caregiver
Okay.
getting paid.
Okay. Well, is there any RADSE type service for the individual with IDD under 18 years approved for 1959 services? I have a non-blood related guardian who would like to provide this service for her 3-year-old, who she is the 24/7 caregiver for.
That is going to be on that FAQ that
Mhm.
we're looking into. I've heard different interpretations, and I want to make sure we're all on the same page.
Yep. Okay. If a member has started living with their
Legal
right.
guardian.
Okay. I was about, okay, another TCM. Um,
Mhm.
but some home But the home is not ideal for the member. Is it possible to get the 1959 funding that helps with moving expenses?
That is a great question, because it talks about approved settings that you're moving out of. And I would redirect you back to the tailored plan, for guidance around that.
If I don't have a care manager, who do I contact?
Your tailored plan.
Yep. Just call them. I do it all the time with families. And, if anybody on this webinar is in that situation and you have Medicaid through a tailored plan, one of the MCOs, and you don't know who your tailored care manager is, or sometimes you just want to switch, I would be happy to be on the phone with you while we make those calls and walk you through it. That is something that I do pretty often, actually. Okay. Is there any way for EIPD staff, which is the Division for Employment and Independence for People with Disabilities? Is that right, Jenna? Okay. To search to see who an individual's care management organization is and if 1959 assessment has been done.
So, what I would recommend, is that staff person, if they are willing and able to do it, to call with the guardian or the individual, call the tailored plan. And that way you can both be on the phone together and ask who the care manager is.
And that really is best.
Mhm.
And I do that as well. Finding out who the MCO is easy because you just, if you know the county they live in, you look at the map. Um, but as far as
Mhm.
finding out the assessment, yeah, calling together is going to be the best way. Do
That way you don't
CAPS,
have to worry about consents and all of those
right?
things. It's just super easy.
Yeah, and just make sure that the person, the family that you're calling with, has the Medicaid number ready to go because that's one of the first things they're going to ask for. Um, do CAPC have access to these services?
That was a previous question, and I think we were going to include it in the FAQs
Mm.
just to make sure we're giving the right answer. But to my knowledge, they do not.
Have a provider that says the local vocational rehab office will approve everyone that applies because they have a shortage of applicants. It's more of a
Is
statement,
that
but
a
that's
they will approve every staff person?
I have a
Um,
provider that says the local vocational rehab office will approve everyone that applies because they have a shortage of applicants.
I don't know that I understand.
I guess
I don't
people
know that I
applying to
understand the
get the
question.
service. Yeah, I don't know. If you want to rephrase that into a question, we would be happy to give it a go. Let's see. Can a CAP adult be eligible? Which service is the better for the client? So we will again include that in the Q&A doc. What is the current estimated wait time for a 1959 assessment to get approved once it's requested or submitted?
So once it's submitted through the state system, our turnaround time is the most recent I heard is like 7 to 10 days.
Okay, because I've had questions around that too.
And now, does that information always get back to the care manager in the time in that same 7 to 10 day period? We're looking into that to see what that process looks like.
Okay. Uh, Yay. Okay. Thanks, Holly. So I got a message in the chat that says, Hey, Christy, to help answer the question about if 1959 assessment has to be in person, it can be telehealth, but must be face to face. So I guess the person has to be there. Said, I've done many video chats for assessments. So that's good.
That is good to know.
Well, anything, thanks, Holly. Well, anything, is anything going to change now with all the federal changes going on, funding, et cetera?
As of right now, there are no major changes happening within our division and department. These services are continuing. But as we all know, things change very quickly. So,
Very, very quickly. Yes. So we will stay on top of that. Also, if you want to know updates, like Ginger mentioned, sign up for their mailing list, their email list. I do. It's great information that comes through. Attend those side-by-side webinars. If you want to be kept, if you want to keep up with things as they're happening, those really are the best things to, best ways to get information. How can public schools help ensure our students and their families are aware of this support? Or if vocational rehab is the connection, how do public schools best support this partnership?
we are wanting to create more of a relationship between DMHDDSUS and our school system because we know a lot of families go from early intervention right into the school system and may not get linked to the tailored plan. So we are working on that. However, if you work in the public school system and want information, reach out to us, reach out to the tailored plan, and we can get some printed materials to share.
That would be
We
great.
have, yeah, we have an accessible communication campaign that's going on right now. Um, and we're trying to make this easier to understand. So we have some materials that we can share with folks.
That would be fantastic. And also, I just kind of want to plug us to, I do presentation. I just did last week, did a presentation for a school system on Medicaid waivers and 1959 services. So I'm happy to do that and make it as long as short as possible. And like Ginger said, she can get you some printed materials. So we can absolutely work together to do that. I think it's so important because when I help a family that has not heard about a waiver or hasn't heard about 1959 or didn't know they were on the wrong Medicaid plan, it happens. They're like, how come my pediatrician didn't say anything and how come the school didn't say anything are the two questions I get, because those are the two systems that these kiddos, almost all kiddos, are going to touch these two systems. So it's very important. Thank you for that question. And yes, it would be great if therapists knew about that stuff too.
Absolutely.
And same. Let's see. Can we clarify the Medicaid piece one more time? We're on the innovations waiver waitlist and have private insurance. I'm not familiar with the Medicaid expansion that you just referenced. Is that an income bracket expansion?
So it was an eligibility expansion. So more people that didn't previously qualify for Medicaid, due to income, due to various reasons, now can qualify for Medicaid. So I recommend if you didn't qualify before, maybe a year ago, I think we've been a year now, to reapply. I feel like you're not in a worse situation if you reapply and get the same answer, but definitely reapply.
And I think the other part of that question is if you have private insurance and you are on the innovations waiver wait list, can you get 1959 services?
Only if you have Medicaid. So you must have Medicaid in order to access 1915I services.
Okay, for people who have their Medicaid paused due to being in certain facilities, we cannot access 1959 because Carelon won't accept the 1959 assessments when Medicaid isn't active. Is there a workaround for this?
We are working on that, Anne. This has been brought to leadership attention, and they are working on that piece.
What is the difference between the innovations waiver? I know it has a wait list, but does it offer more in the future?
So the innovations waiver does have additional services provided under it. So there's assistive technology. One of the big ones under innovations that isn't under 1959 is residential supports or supported living. So if someone wants to live in like an alternative family living situation or a group home, there are services to provide that 24-hour care. And then the limitations are a little bit different under the CLS respite supported employment.
So that's a great question. I'm going to include a link to the site that talks about the innovations waiver services. And then I'm also going to include a link, the state website, but I'm also going to include a link to a section on the innovations waiver on Advocates for Medically Fragile Kids NC website that has great information on CAPC and Medicaid, but also on innovations waiver. I'll include that in the follow-up email.
And we're finalizing our accessible comms around innovations right now. I think it's actually on its way to the department communications to make sure we're following the rules.
Let's see. Okay, we got time for a few more. I have been going through this process for many months to get from the standard plan to finally being approved for 1950I. No one has mentioned age limits for respite care. Please reiterate the age limits for respite care.
So for children or for individuals with IDD or TBI, it's age 3 and up. And then I actually pulled up the slide. For individuals with serious emotional disturbance or substance use disorder, it's ages 3 to 20.
What would 1959 services look like for a 5 and 8-year-old? I have confirmed eligibility, but not sure how it will benefit them and our family.
For a 5 and an 8-year-old, again, navigating social interactions. It can also support learning safety skills. So, understanding how to use a crosswalk, for example, might be a big piece of it, or understanding how to cross a road without a crosswalk, for that example, or for that matter. It can also be used to support how they bathe, because by the time they're 5 and 8, they probably have some pretty good um, bathing skills, but but for someone with a disability, they may need some more support on how to wash their hair, make sure it's rinsed out all the way, those things. Organizing their after school activities. So, making sure that they have everything they need for if they're involved in, like, what is the Best Buddies program for like baseball, making sure they have everything they need for that and organizing that. Helping them understand their emotions when they get frustrated, some alternatives to expressing themselves physically. They could help support them through using their words or using a different way to express those frustrations. So,
It's a
yeah,
good question, and I get this
it is.
one often. Does parents' income still impact whether or not a child with a disability can receive Medicaid? Thought expansion might have changed this. Any idea where to go to find this information?
I am going to direct you to, I believe it's DSS, for Medicaid eligibility information. But we can put that in the FAQ as well.
What are the steps to go for a 21-year-old that has Trillium and just finished a GED but wants a job and all signs of Asperger's?
If this individual has been formally diagnosed with a disability, with an intellectual or developmental disability, then you would call Trillium or your care manager, and either be referred to EIPD, or if they've already gone through EIPD, then they could be referred for supported employment. Potentially, they would have to go through the 1915I assessment and all of that. But the care manager would be the one to support this process.
And this next one looks like maybe a clarification to a previous statement or question I asked for, but I don't remember how it goes together. So, Ginger, maybe you do.
Yeah.
If the member is over 18, a family member can be their DS worker.
Um, yeah, they're DSP.
Mhm.
If a family member is over 18, and does not live in the home, I think that's another piece. Then they could potentially be their direct support provider.
I think it says if a member is over 18. So if the member who's receiving it is an adult, can a family member be their DSP? I think is what it's asking.
So we're going to get some more clarification on relatives as providers.
Let's see.
Edwards looks like he's adding a great resource.
Mhm. Move on to another question. I'm an early intervention service coordinator. Glad you're here. If I want to provide a family or child who I feel could qualify for these services after they transition from my program at age 3, what would be the best way to give them information on your program or how to link them with your program? I'm assuming 1915I.
Um, so I would I would direct them to the tailored plans for their county, to see if they are tailored plan eligible and get a care manager assigned and do that warm handoff to a care manager.
And also, Brandy, I have my contact information in the chat. If you wanted to reach out, I'd be happy to help you too. Let's see. Oh, the question. Edward put his question
Oh,
in parts. Okay, hold on here. Um, so he talks about the bridge program.
mhm.
Okay. And then says, can CLS group be used for this?
That is a question I do not have the answer to. I think we would need better understanding and to work with the tailored plan provider network person.
Mm-hmm. Not ready for supported employment yet. Okay. Um, we already talked about the age limit for respite care. That's 3 years old minimum. And then there's no age cap for somebody with IDD or a traumatic brain injury, correct?
Correct.
And if you have substance abuse or mental health needs, it's 20.
20. Mm-hmm.
But I passed the test. Okay, couple more.
Right.
Do we need to find the person who provides the respite services? So do you have to find your own provider?
So your provider agency should be searching for someone to provide respite services. But if you know somebody, you can refer them to provide those services.
What type of training is needed to provide the community living and supports and or respite services to individuals?
So there are very specific training requirements outlined in like statute and things like that. So they will get training on let's see, person-centeredness. They're going to get training on the diagnoses specifically. There's like 6 areas. They also get CPR, first aid, and crisis prevention training. So, you know, preventing those behavioral outbursts and how to respond to prevent someone from having a behavioral outburst. And then different agencies also have different trainings that they require. But they should also be trained on that individual's needs and their person-centered plan or individualized support plan.
Next question. Where do we find the waiting periods for the innovations waiver per county?
That is not listed, and it's because it is a very complex question. Access to the waiver is highly dependent on the General Assembly giving us additional waiver slots. So they actually have to put it into the budgets to add slots to the waiver, which then impacts like wait list time and things like that.
And just something else I want to add, because this is a question I get often. There is an innovations waiver dashboard, and I will include the
Mhm.
link to that. It will show you how many people are waiting in each county, but it is not going to tell you how long you're going to wait because a slot coming open depends on so many things that we can't control or have any idea. I mean, you're waiting on the General Assembly to fund more slots, or you're waiting on somebody to die who had a slot, or you're waiting on
Mhm.
somebody to move out of the state that had a slot, or you're waiting on somebody to be admitted to an intermediate care facility long term. So, because we don't know when those things are going to happen, there's no way to tell you how long you're going to wait. So, when you're on the innovations waiver waiting list, your wait list, you're not a number. You're not 1, 2, 3, 4, 5. You are literally the date and the time you were approved, right? Your application was approved and you were placed on that waiting list. And it moves up based on people getting slots and accepting them or denying them. So that all of that to say, there's no way to say you're going to wait 18 years and 3 months. It'll be, this is how many people are waiting and you're here kind of thing. Good question though. Regarding assessment in person, regarding the assessment in person question, I recently had my son's 1959 assessment in person. We were told it's preferred, but not completely necessary. We could have also done it via Zoom or on the phone. Our care manager was very flexible and offered to do it at another site or even in parts. She did her best to accommodate us. That is excellent to hear. I love that. It's very important. Okay. To follow up on the provider shortage, I think parents are able to be the CLS worker because there are no workers. I could be wrong, but I know parents who do get paid for this. Could this be the case?
So community living and supports is provided under 1915I and also under the innovations waiver. For the innovations waiver, there is a way for relatives to provide that service, but the 1915I piece is the one that we're not sure about. And we want to get some firm clarification from our Medicaid partners. which is
And
also what makes it really confusing because there's three different funding streams for community living and supports,
well, that's
all
interesting.
titled the same. Yeah.
In process of requesting change to a tailored plan for my daughter, we're sent to the Medicaid broker page to complete the request form, which is 16 pages long. Does that sound right? So I'll let Ginger answer, but I have personal experience with this process as well. So go ahead.
I do not have personal experience with this process, but that sounds awful
Yes.
to be directed
So,
to 16 pages.
right. So, and I have helped people transfer from a standard plan to a tailored plan. And we did call the enrollment broker and we were sent the forms. So there are two sets of forms. If this is, now I did this back in July of last year. So as long as nothing has changed, there are two sets of forms. There's a set of forms that providers are going to fill out. That is the 14, 16, I think it's 14 pages or 16, whatever, long one. That's the long one. And so your provider can initiate that change. Basically, it's a lot of asking for a lot of information about the person, right? And the doctor is responsible for entering all of that information. In one case that I was working on, the child's pediatrician was like, I do not have time for that. I'm so sorry. Have a good day. And was like, nope, not doing it. So at that point, we did the member request to change form, right? Where the parent can fill it out for a minor child. That was only 4 pages long and it was much more doable. So that's the one that we did. The benefit to have the provider do the form is that the transition can happen quicker per the enrollment broker, uh, usually within 7 to 10 days. If the member does it themselves, they make those changes on the first of the month. So if you're filling out this form and submitting it on the 5th of the month, you would have to wait to the first of the next month before that change went into effect. Um, and that's the way it was back then. But yeah, no, the provider document is the long one. Anyway, feel free to email me if you need help going through the process. I'd be happy to help you. This isn't a question, but a suggestion. We will take those. Let's see. My son has Trillium as his tailored care manager. Months had passed before getting his tailored care manager. So I called the Medicaid ombudsman and I finally got a call back the next day and assigned a tailored care manager the following week.
That's good to know.
Yeah, there's been some snafus here and there, and honestly, it's sometimes it's impossible to find out the reason why. The important thing is hopefully you got connected to one, and it's working for your family. There is a question in Spanish. I don't know if Flor, you can come on and translate that for us, or Christian, or they might put it in the chat. And if not, we will get that answered in the Q&A document for sure. Oh, all right, Jessica, hold on. I know what you're going to do, so I'm going to let you, if I can find you.
Jessica, I knew you were on this call. I could tell from the questions.
All right, hang on. I'm going to have to find her in this long list of folks. Okay, Jessica, go ahead.
Yo no hice la pregunta. I don't make in the question, like, I don't make in the question in Spanish, but if you give me where is it, I can read it for you and make it.
Yep, I will put it in the chat. Thank you. Jessica is on ECAC's board, and she is a very active member in the community. There you go, Jessica. It's in the chat.
Okay. Is
She is a phenomenal advocate, by the way.
Yes.
Thank you. I have two kids with special needs, and they are waiting for years for evaluation for the autism. Is someone who can help and where they can go?
Yep.
So that is a common issue, waiting for the autism evaluations. I would typically direct you to the tailored plan, to help navigate and get an assessment.
Yep, and have your tailored plan or MCO refer to a preferred psychologist if you have Medicaid. Also, you can email me. Emailing me in Spanish is okay. And then I can connect you to one of our Spanish-speaking parent educators who can assist you further. Okay, wow, we are at 1:30. So we have a couple of questions left, but we did get through a lot. So I don't want you to think that your question is lost forever if we did not get to it. So we are going to save this Q&A and we are going to make a Q&A document and we are going to answer them and we will get that out. Now the Q&A, the follow-up information for the email. Again, I'm going to try to get it out this afternoon. If not, it will go out by the end of the day on Monday. The Q&A document that Ginger and I were talking about is we're not going to put a for sure timeline on that because it is going to be dependent on getting answers from other entities and we don't know when they're going to answer us. So I promise you that I will email it out, but I don't know exactly how long it's going to take. So just keep an eye on your email. And we will get that out to you as soon as possible. We had a huge audience today. I just want to say thank you so much for taking the time to attend this today and to help get this information out to families. Ginger, thank you so much. This was fantastic. We really appreciate your partnership on this.
Anytime. And thank you guys for having me. We're trying to get the information out there. We want people to access these services and get the supports that they need. So anytime.
Wonderful. And lots of thank yous. A lot of Ginger rocks. Look at that. Awesome.
Hey, Marjorie, I didn't know you were in there.
Thank you, everyone, so much. We hope you have a great rest of your day, and we hope you join us again for another webinar soon. Take care, everyone.
Thanks, y'all.